Shortly after the minister's briefing there in Abuja, the Lagos State government held its own briefing, also confirming the death of the nurse and providing more details.
Based on the contract tracing arising from the index case that came into the country, that's the Liberian, we have been following up a total of 70 persons who have been primary contacts to that person. That is, we'll be monitoring. Of these, currently, 8 have been admitted and blood samples taken. Results of 5 out of the 8 samples taken have been received, with 4 out of the 5 testing positive for Ebola. The results of the 3 are outstanding. Regrettably, too, one of the 8 persons admitted died yesterday at 2:06 p.m., thus making deaths recorded on account of the Ebola outbreak in Lagos to amount to 2. That is yesterday's and the index case. Meanwhile, because of this, like I did say again, we've started secondary contact tracing. And I said this is also a tedious matter, but you have to take each one now and start finding out who are the people that could be possibly secondarily infected. That is the close contacts of all admitted, of those admitted. We've started that, and as at now, and as at yesterday, 27 of them have been identified, and we are still counting.
Now, the Commissioner for Health also used the opportunity to make a passionate appeal for medical volunteers to help in contact tracing and care for patients.
We need volunteers now, very extremely necessary, urgently needed, to assist us in tracking the contacts, and more importantly, to manage those cases that are already in isolation. If we want to give them a chance for life, they need to be properly managed. So we need doctors, we need nurses, environmental health workers, phlebotomists, etc., like we said yesterday. Because this is a very serious matter, our government, Lagos State government, is willing to take such volunteers, especially in this area that I mentioned, for whatever you think we're ready to give, whatever it is that they want, including life insurance. And we want to assure them of their safety. If they come in, they will put through all the regular processes and procedures for safety. How to wear the PPE equipment, what to do when they make contact patients, so that you reduce physical contact. But the fact is that we need these people to take care of the people we have. And through this medium, I wish again to allay the fears of health workers who have the requisite expertise needed to manage these confirmed and probable cases. The bottom line is that if we cannot provide this requisite quality and quantity of healthcare workers needed for the management of these cases, outsiders who are willing to assist us will find it difficult to come in and help, as is the case in scarce human resource healthcare settings. And let me say it again. We have to take responsibility for our people. If we, our experts, cannot come in and assist, it is very difficult and morally unjustifiable for us to ask people from outside to assist us. So we are willing to do whatever it is necessary to get them in. These are the volunteers. We provide their safety. We provide whatever it is they require, including life insurance. We are already processing that with our insurance company. This is to show you how seriously the Lagos State government takes this matter.